Kidney disease. It can also lead to kidney disease or kidney failure. I remember a very sad case years ago of someone who had kidney failure, and it was entirely preventable. This gentleman came into the emergency room and he had blood in the urine. And so he was admitted and worked up for this, and they didn't know why. And also his blood pressure was very high at the time. And in the course of the workup, when they did a kidney biopsy, they found that the cause of his kidney failure was long-standing hypertensive disease. And he mentioned that the last time that he had seen a doctor was 10 years before, and he had been told then that he had high blood pressure. And to make a long story short, he had about 10 years of very high blood pressure that just destroyed his kidneys, and it could have been prevented, and now he's relegated to a life of being on dialysis. So that's an example.
It's unfortunate, but at my firm we had a case, a very sad case, where there was a gentleman who had high readings for quite some time. It was a period of probably a good 4 years that they were just not controlled. Very little medication was given, it wasn't working, and unfortunately he wound up developing cardiomyopathy, had a heart attack, was doing very poorly, and was on a heart transplant list towards the end because it just had damaged his heart so badly. So it's very, very clear cut to see what happens when, you know, it's not being controlled. It can really do some serious damage to people. It's a shame.
And it's easily preventable. And you just have to pop a tablet, and most of the time people tolerate their pills, the medicines very well. As far as treatment goes, I go by an old beer commercial, which actually has some wisdom, which is less is more. So we usually try to give them the least amount of medicine that's necessary. And then everybody comes out ahead if they feel comfortable with the medicine. And also an important part of management of high blood pressure is to speak to the person and, you know, let them know one-on-one what you're doing, you know. So show a little compassion, educate them, and let them know that it's a team effort, that you're there for them to help them.
What type of diet would you recommend?
Oh, that's a good diet. Good question. They always talk about the no-salt diet, but actually the truth of the matter is a no-salt diet. You don't have to be on a no-salt diet, but somewhat of a lower salt diet is good. Sometimes if someone's a little bit on the heavy side, a low-carb diet that's been shown to cause the greatest amount of weight loss, and it's also a good diet for people that have diabetes. Sometimes if someone's diabetic and they have high blood pressure, the high blood pressure can really accelerate kidney disease. So I'd say in general just a low salt diet, and maybe cut down on the carbs. We're less concerned about fat actually these days. But
because there are healthy fats though that are good for a certain amount of people for certain quantities in your diet.
Absolutely. I mean, there's such a thing as animal fats and plant fats. Like the difference between, let's say, butter and olive oil. You know, we know that olive oil is good, has a lot of essential fatty acids. So a little fat is actually good for you, helps the brain develop.
The Mediterranean diet is supposed to be very good.
Yes, yeah, they had big reports showing that that's a good diet to follow. So I'd adhere to that. Also, I'd say, in addition to stressing, you know, what not to take, I'd also stress sort of a high-protein diet is good as well.
Now, when you talked a little bit about aerobic exercise too, I think that covers anything from walking to cardio to treadmills to actual aerobics, as people did, but depending on the condition of the person and the weight of the person and whether or not they've ever exercised prior to being diagnosed, it probably matters. I mean, even small steps such as walking 15, 20 minutes a day probably is a good thing.
It makes a big difference there. I was looking at a bunch of my patients' charts recently there, and these were people that are over 90. And I wanted to find the secret aside from genetics. I was thinking, well, maybe I should be drinking a bottle of wine every day or not. Unfortunately, that was not the answer.
Oh.
But actually, three things.
It's a good study to
three
try.
things came up though that that pointed to a long lifespan. Number one on the list was actually control of high blood pressure. Number two was control of cholesterol. And the one that I never saw coming actually was that the vast majority of these people that were in their 90s were big walkers. So I wasn't a big fan of walking until I saw this with my own patients.
Wow.
So I think walking is good. And there's an old saying that it's better to light one candle than curse the darkness. So just if you just do a little bit. For people that want to get started, I often recommend what's called the Swedish method or the Scandinavian method. And that's just a fancy way of saying do what's called the walk-jog. And I tell people, you know, you walk half a block, maybe jog very lightly for half a block. When you feel a little short of breath, just move it down to a walk. So just walking, a little light jog, and by getting the heart rate up, it dramatically brings the blood pressure down.
And something is better than nothing as far as starting an exercise program.
Yes.
You know, you could start small and work your way up and...
Yeah. Yeah, you definitely start small. Sometimes just getting outside at night and just walking with your spouse, you know, that's good. And then, you know, you start throwing a few little jogs. Sometimes even at home, if you just want to do a little jog in place. And I'll tell you why it's important. It's been shown that if you do some exercise, the majority of the calories you burn isn't actually at that time, but in the following 3 hours. Actually, some studies have actually shown that if you exercise, you continue to burn calories up to 7 hours later.
Wow.
So
that's interesting.
every
Very
little bit
interesting.
helps. It sure
Well,
does.
sure, taking the stairs instead of the elevator if you work somewhere, parking your car a little bit farther away from the front door of the stores and things like that. Every tiny bit makes a difference. People seem to think, well, if I'm not going to go to the gym and work out 5 times a week, forget it, I'm not going to go. But every little tiny bit of adjustment that you make in your life is going to have an impact. And the same thing goes with diet too. If you just say, okay, this time I'm going to choose an apple instead of a candy bar, you think, well, that one thing isn't going to make a difference. But if you do that a few times a week, it probably has a huge impact. Switching to water or even some of these other fruit drinks instead of soda has a huge impact. And it's just the little things you got to try little by little and you'll get there.
Yeah, and if nothing else, if it just even maintains you so that you don't gain more weight, that's good in itself, you know. And then you don't feel as guilty. You know, there's an old saying, you work out the pig out. So for those of us that really don't like the diet so much, you can compensate a little bit by exercising a little bit.
Is there any key point or a really big important thing that you think that you want to drive home to your patients and the viewers about hypertension or general health?
I would say yes. I'd say one, take your medicines. It really will make a difference. It's been shown that if you keep your blood pressure under control, that you add at least 10 years to your life. You also avoid those terrible strokes that you see. I'd say get your blood pressure checked fairly frequently. A lot of people are resistant to that. And probably the best advice I'd say is just get your annual checkup. You know, that can help your blood pressure and can pick up so many other things as well. It really makes a difference. I see the human body as basically a machine. And doctors, including myself, we're basically mechanics. And we just check all the different parts. So invest in yourself, I'd say.
Good advice. Good advice. You only get one you, so.
Yeah, only one life to live.
Exactly. Dr. Sass, would you tell us again about Princeton Internal Medicine?
Sure. It's a high-quality group in Princeton. We see people from all walks of life. There's 4 of us. We try to pride ourselves on providing compassion and quality. And probably, I think, one of the hallmarks of our group is to be thorough. I often tell people that the real mark of a good doctor isn't so much how much he knows, which of course would help, but also how thorough he is, you know, that he takes the time to dot his I's, cross the T's. So we try to be thorough, and my colleagues have impressed that upon me, and I've passed that on to my patients.
It's wonderful. Thank you for having us. We really enjoyed
Oh, well,
our
thank you
conversation.
for the opportunity.
Thank you.
Well, thank you very much for tuning in today and watching Medical Tips You Need to Know, our interview with Dr. Timothy Sass. Again, at the end, you're going to see our website. Feel free to get in touch with us and give us any remarks or comments you may have or questions. We'll be sure to get them to Dr. Sass if you'd like to direct them that way. And always remember, get educated, get empowered, get healthy.